Dependent. What is dependent personality disorder?
The dependent personality disorder shares a lot of characteristics with the avoidant personality disorder in the sense that they have a lot of social inhibition and feel rather inadequate. However, the major difference between avoidant and dependent personality disorder will be the presence of the individual on whom the dependent personality is dependent on. This will be someone who they feel needs to assume responsibility for many of their daily activities.
What are the signs of dependent personality disorder?
The dependent personality disorder patient will see themselves as incapable of making decisions or doing anything independently in their lives on their own. And if they are forced to do it, they will see themselves as doing a bad job of it. So it can get as ridiculous as they need help deciding what to wear in the morning. You know, they just have absolutely no confidence in themselves. They will endure unpleasant, unsavory things to keep the dependee happy. So, you know, they'll see movies they don't want to see, they'll eat food they hate. You know, they will do almost anything to make sure the person they're dependent on stays with them. And you'll see a lot of anxious, frantic behavior if they think for whatever reason that the person on whom they're dependent is going to leave.
What are the causes of dependent personality disorder?
There are no known causes actually for dependent personality disorder. However, there does appear to be an association. People who have separation disorder, separation anxiety disorder of childhood may be at higher risk to develop dependent personality disorder, or you can even sometimes see it in people who were real sick as children, a lot of medical illness or whatever, and then it's almost as if since they were so disabled as children, they never really developed that sense of self-confidence that they could operate independently as adults. Whether that's actually causative, it's just an associated finding.
What are the dangers of dependent personality disorder?
Probably the biggest danger for them is, you know, in the social sphere, they rarely have any other friends except for the individual they're dependent on and perhaps maybe one other person. They're not going to initiate tasks very easily or well, which brings me to the occupational dysfunction too. This is not going to be your go-getter employee, you know. They could probably do something if they weren't required to have any initiative.
Who is at risk for dependent personality disorder?
The disorder does appear to be more common in women than men. Other things that may put an individual at risk to develop a dependent personality disorder would be serious illness, childhood illness, and separation anxiety disorder of childhood.
What are the treatments for dependent personality disorder?
There aren't any known treatments that consistently work for the personality disorder itself. I think some psychotherapy can be very helpful in terms of helping the patient develop a little more self-confidence. It may be that during the course of psychotherapy that the person transfers their dependency from the dependee to the therapist, which would have its own risks. But on the other hand, as a therapist, you would be invested in having the person slowly break away from you, whereas the dependee may not have that same investment. Since these patients are prone to anxiety and mood disorders, if they were to meet criteria for any of the anxiety or mood disorders, they should be treated appropriately.
What role does the dependee play for a person with dependent personality disorder?
I think that is usually what you'll find is as a person with their own issues. They may enjoy the sense of power that they have over this other individual. They may have it may be someone with a need to care for someone else. Otherwise, you know, if you don't have those issues, you're going to get out of that relationship pretty quickly, and you're going to create a lot of anxiety for the dependent person.